I'm one of the physicians at Holtorf Medical. I've been with the group for about 12 years. Treat patients for hormone replacement, also chronic fatigue, fibromyalgia, and in the last few years, we've been treating patients for Lyme, chronic Lyme disease. Well, I've been practicing medicine for over 40 years. Initially, I was an internist, so I'm a board-certified internist, and I did a lot of just regular medicine until about 15 years ago. I was working as a consultant for a group in Arizona, and they were doing a lot of hormone replacement. So I kind of started being fascinated by hormone replacement, and then when I got tired of traveling to Arizona all the time, I happened to talk to Dr. Holtorf, and at the time we were doing pretty much hormone replacement. That was our main focus of our practice. But then we found that a lot of patients that had hormone issues, and so we started treating a lot of patients with chronic fatigue and fibromyalgia. And then subsequent to that, we found that a lot of patients who had fibromyalgia and chronic fatigue, their underlying problem was Lyme, and so we started treating Lyme. So we kind of evolved into what we do right now. Well, for what we do, it's something that has gone unrecognized for a very long time. Patients, have been, having issues, have had a lot of symptoms, and a lot of times, they go to the regular physicians and their symptoms are either dismissed or, they just, they're not believed, And so they get to the point where, they figure, well, this, maybe there isn't anything wrong with them and it's all in their heads. And the reality is that it isn't. We find that if you do the right tests and you actually take the time to listen to the patient's history, you find that their complaints are very legitimate. And once you start treating them, you see a difference in how they feel, and that really is the most important thing. There's with Lyme patients, a lot of them, are very desperate. They've been sick for a very long time, and it's just very gratifying when you're able to help them. Most of them, come in having really, pretty much every day is a bad day. Then after we've been treating them, they start having some good days, and it's just nice to see the way that their lives change. They actually, have lives again, and so that's the thing that I kind of, look forward to. I still see patients from the first year that I was working with Holtorf, and I actually told them that I was thinking of retiring, and they got very upset. So I guess that's a good thing, isn't it? The gratification of seeing a patient who, when they started seeing me, they were spending most of the time in bed, and now they've gotten their lives back. That really is the most gratifying thing. I certainly feel that I've helped a lot of patients. Have I helped every patient? No, but I have patients that I have done nothing for, and they continue to come to me. And I keep telling them I've done everything else, everything that I know what to do, and I don't know what else to do, But they feel that at least there's somebody who's willing to listen, and who's willing to, if something new comes up, willing to try it.